Safer initiative is a project of AVI Health and Community Services in partnership with Solid Outreach. And we're a safe supply project that aims to provide pharmaceutical alternatives to the toxic drug supply caused by criminalization. And so, as Karen said, my name is Heather Hobbs and I'm the project manager, and with me is Jaclyn Letourneau, who works for both AVI and Solid and is one of our safer outreach workers. So we just wanted to start off today with our own land acknowledgement, and just to say that we work on the lands of the Lekwungen speaking peoples, lands which continue to be violated by colonization and whose people continue to resist ongoing genocide. We honor the life force of the territories and the people of these lands, including all Indigenous people living on these territories who have been forcibly displaced. And we know that ending the overdose crisis is deeply connected to ending colonization, and we commit to that work together.
We also want to acknowledge that the information we are sharing is made possible by people with lived and living experience of criminalized drug use. These individuals share their knowledge and experience with us. And without their generosity and patience, this presentation would not be possible.
So today we just wanted to share some information with you about how our project has started out about 6 months ago, describe our project model, give you a bit of a progress report, talk about our evolving service model development with people with lived and living experience, describe our project evaluation, and then talk about what's happening going forward. So our project is a response to the call from Health Canada's Substance Use and Addictions Program to develop a flexible model which provides pharmaceutical alternatives to the illegal drug supply with, quote, as few barriers as possible and without the expectation to transition to treatment. So we were funded for 8 months. And so given that quick timeline and also the urgency of the ongoing overdose crisis, we wanted to start providing services as quickly as possible in the community. But we also wanted to center our model in the knowledge and experience of community members, and particularly current and potential service users. So one of our first priorities when we got going this past July was to conduct a series of interviews and put out a survey to representatives from about 12 different local organizations in Victoria to ask them how they thought a safe supply project should look and work. And so a report was generated from this process, which identified a number of things that were going well in the first 4 months of prescribing under the BC risk mitigation guidance, as well as a number of identified barriers and areas for improvement. And some of the responses were that things that I think many of us already identify, which is that people who use drugs should be engaged, that a demedicalized model should be developed as much as possible and supported by regulatory changes and sustainable funding, and that people have the right to the right substances in the right form at the right time for them. And so in addition to that community engagement process, we also formed an advisory network, and that includes folks with lived and living experience, service providers, researchers, folks from the government, nurses, etc. So this slide might be a little difficult for you to read on your screen, but don't worry, we're going to zoom in a minute to some of the elements on the next slide, so you'll get a closer look. But we just wanted to give you a broader visual depiction of our evolving service model. So you see on the left-hand side at the top in the teal, it identifies there that the goal of SAFER is to develop a person-centered approach to providing pharmaceutical alternatives to the toxic drug supply. And we're doing that with an interdisciplinary team that takes a harm reduction approach and really aims to center participants in the project. So the circles of this model really highlight the roles on the SAFER team, which includes outreach workers with lived and living experience, sometimes referred to as peers as well, nurses, physician prescribers, and systems navigators.
At the heart of our work is how we use harm reduction to build relationships in our community, and the work that our outreach team does. As a safer outreach worker, I'm an ambassador of our program, and I work to build relationships between people and service providers as well as offer my support as someone who has lived experience of drug use and criminalization. This photo is of me and our clinical nurse lead, Corey, from a recent newspaper article about our program. In the article, I've talked about how I've lived in the same situation as people we're working with. I've been at a shelter, I've been on the streets, I know what they're going through, and I can relate to them and be like, hey, this person is trustworthy. I work with them and you know me from the community. I introduce our people to our nurses and our systems navigators. We work together to determine if people are eligible for a program, to determine a care plan. Our nurses do physical assessments, they take blood, do wound care, COVID-19 testing, and other primary care, all out in the community. They call our safer docs and work together to determine the best available options for prescriptions, as well as making a plan for other healthcare needs. We have 5 doctors working with Safer who share a weekly rotation on-call support and on weekends and holidays. Our systems navigators, they're really awesome, work with people on housing applications, and income assistance, and ID, and other social supports.
So this slide gives you a bit of a snapshot of our intake process. So eligibility for SAFER includes using substances that are currently illegal and therefore puts people at risk for overdose. We're currently working primarily with people who are homeless. So there's close to 70 folks who completed intakes with us and who were homeless at the time and remain homeless. About 12 people were housed at the time of their intake. And since completing intakes with us, only about 3 people have been housed. So housing is obviously a huge factor and a big barrier for people being able to access safer supply. And so we're trying to bridge that gap for them. If folks have worked with a prescriber within the last 14 months or are already living at a housing site where healthcare is provided, including safer supply prescribing, we work to reconnect them with their care provider. Our intake process is really aimed to be person-centered in that we ask people what they think would work best for them in terms of prescriptions, and then we try and work with them around that as much as we can. Most of our participants are on daily pickups from their pharmacy of choice, but we also have a small number of people receiving their medications from our daily delivery team. So SAFER has completed a significant amount of work since our project went live about 6 months ago, and this slide just highlights some of the preliminary data from the first 4 months. Almost 3/4 of our participants identify as men, and we're connecting with participants at over a dozen locations, primarily encampments within the municipality of Victoria and also into Esquimalt, West Shore, and Souk. And you'll see that most of our participants, about 49%, are receiving opioid scripts. About 38% are receiving opioid plus stimulant scripts. And about 13% are receiving stimulants only. So SAFER docs are providing a broader range of options than are currently included in the BC risk mitigation guidance. And that includes options like oxycodone IR 20 milligrams. And of our opioid-only prescriptions, about 52% of scripts do not include OAT. And our most common combinations of opioids and stimulants are dextroamphetamine and oxycodone, and also Cadian, Dilaudid, and dextroamphetamine. We're encouraged by the preliminary feedback that we're hearing from participants about the positive impacts that they are experiencing from having access to safer supply meds, including a reduced reliance on street drugs and improvements in their health and well-being.
An important principle of the SAFER project is to keep people who use drugs at the center of it all. To help us with this, we have been working with our partners at Solid Outreach and with Dr. Bernie Pauly from the Canadian Institute for Substance and Use Research. We were approved in early September by the Research Ethics Board to hold focus groups and to use the concept mapping to help us develop and evaluate our work. In the fall, we conducted focus groups with a total of 35 people at various locations, including overdose prevention sites, other organizations, and outdoor with people in encampments. We heard from people with different perspectives, including youth, sex workers, indigenous people, people living in hotels and shelters, and people who use stimulants and peer workers. Our focus groups were co-facilitated by research associates from SOLID and from UVic. And we are currently in the process of sorting out our data and preparing to analyze it. This work is happening at the same time that we are doing our research so that we can continue to match how we're working with what we are hearing from our focus groups.
Awesome.
Thank you.
So SAFER is also part of the province-wide evaluation of prescribing under the BC risk mitigation guidelines called Mixed Methods Evaluation of Risk Mitigation Measures to Address the Dual Public Health Crises of COVID-19 and Overdose. And this will include a chart review as well as qualitative interviews and quantitative surveys. And we're looking forward to having a closer look at that data so that we can connect what we're hearing from participants with the information that's documented through those methods. So we've made a number of adaptations to our work already, and we're continuing to identify opportunities for how to expand and improve on what we're doing. In December, we added a daily medication delivery service for participants who face barriers to attending the pharmacy every day. And our medication delivery team consists of a nurse and an outreach worker and operates 7 days a week. We've also had a chance to work with SOLID and one of our physicians to pilot a MySafe vending machine, and we're looking at options for how to potentially expand the use of that option. Our SAFER MD cohort wrote their own clinical workflows, including safer prescribing practices based on the provincial guidance. And our project is definitely interested and prepared to continue expanding the pharmaceutical options that we can offer participants as they become available through the province. We know that the medications that are currently available don't meet the needs of people who are using stimulants that well, or people who smoke their drugs, and also folks who have high tolerance to fentanyl. We're hoping that nurse prescribing becomes an option. We're hoping that also that one day AVI and SOLID will be able to realize our dream of a comprehensive accessible drug users resource center. And we think that SAFER would fit really well into that and embed really well with OPS and SCS services, in addition to our current focus of outdoor outreach. So our team has already developed significant capacity and expertise. We're really looking forward to sharing more information as we start getting into the chart reviews and also sharing our concept mapping results. We know that decriminalization, legalization, and other things like access to housing options and mental health supports are really at the heart of where change lies. And we know that we're continuing to do this work to try and demedicalize safer supply provision, and that's really critical as well. We hope to continue to have the opportunity to expand access to prescribed pharmaceutical alternatives and continue to challenge the larger structural changes that need to happen to end the overdose crisis and to root our work in community-driven harm reduction. This little picture here is a slide of our SOGI team, some of our team members who work in all weather, and you can see they've been out in the rain that day, and they are in each other's bubble, so don't judge the way they're wearing their masks. Yeah, so that's it for us for our formal presentation, and we're really happy to have a discussion with you as well. Thanks so much for being here.
Thank you.